Good morning everyone. Myself Dr. Devangi Dwivedi, Senior Lecturer in the Department of Oral Pathology and Microbiology, BBDCODS, BBD University. Today I am going to tell you about pulp stones. Pulp stones, also referred to as denticles, are nodular calcified masses appearing in either or both the coronal and root portions of the pulp organ. They often develop in teeth that appear to be quite normal in other respects. They usually are asymptomatic unless they impinge on nerves or blood vessels. They have been seen in functional as well as embedded unerupted teeth. Pulp stones are classified according to their structure as true denticle, false denticle and diffuse calcifications. True denticles are similar in structure to dentine in that they have dentinal tubules and contain the processes of the odontoblasts that form them and that exist on their surface. True denticles are comparatively rare and are usually located close to the apical foramen. A theory has been advanced that the development of the true denticle is caused by the inclusion of remnants of the epithelial root sheet within the pulp. These epithelial remnants induce the cells of the pulp to differentiate into odontoblasts, which then form the dentine masses called true pulp stones. Here you can see the true pulp stone. False denticles do not exhibit dentinal tubules but appear instead as concentric layers of calcified tissue. Here you can see the false pulp stone. Diffuse calcifications appear as irregular calcific deposits in the pulp tissue, usually following collagenous fiber bundles or blood vessels. Sometimes they develop into larger masses but usually persist as fine calcified spicules, usually seen in the radicular pulp. Diffuse calcification surrounding a blood vessel is called as dystrophic calcification. Here you can see the diffuse calcification. All denticles begin as small nodules but increase in size by incremental growth on their surface. The surrounding pulp tissue may appear quite normal. Pulp stones may eventually fill substantial parts of the pulp chamber. Pulp stones may also be classified as free, attached or embedded depending on their relation to the dentine of the tooth. The free denticles are entirely surrounded by pulp tissue. Attached denticles are partially fused with the dentine and embedded denticles are entirely surrounded by dentine. Here you can see three of them. All pulp stones are believed to be formed free in the pulp and later become attached or embedded as dentine formation progresses. Pulp stones may appear close to blood vessels and even nerve trunks. This is believed to be because they are large and grow so that they impinge on whatever structures are in their paths. The occurrence of pulp stones appear more prevalent through histologic study of human teeth than found by radiographic study. It is believed that only a relatively small number of them are sufficiently enough to be detected in radiographs. The incidence as well as the size of pulp stones increases with age. According to one estimate, 66% of teeth in persons 10 to 30 years of age, 80% in those between 30 and 50 years, and 90% in those over 50 years of age contain calcifications of some type. A statistically significant relationship has been found between patients with cardiovascular disease and presence of pulp stones. This finding suggests the usefulness of dental radiographs to identify patients with cardiovascular diseases for further screening and evaluation. That was all. Thank you.